COVID-19 self-test kits have sold out at many locations island-wide, with retailers telling the Straits Times that they are working to bring in more stock as soon as possible. This comes as more people are testing themselves before they go to work or to attend events. As Singapore's Director of Medical Services Associate Professor Kenneth Mark explained on Friday, if you test positive for COVID-19 using an antigen rapid test but are asymptomatic, you should self-isolate at home for 72 hours. During that time, if you are concerned, you may want to visit what's known as swab and send home clinic. If unwell, you should visit a GP as soon as possible. And at the end of the self-isolation, you are encouraged to do another ART test. Let's pose more questions about this to Dr. Tan Teck Jack, CEO of Northeast Medical Group. Welcome to the show, Doctor. Doctor, aside from requirements like going to the office or attending events, under what conditions does a person administer a self-test, and how frequent should that be done?
I think as a responsible individual, in such a time, I think all of us should be administering tests to ourselves if we suspect that we have been exposed to an individual who has got COVID-19, or you are close contact, or if you are in a situation where you feel like you could be endangering other people. I think for the frequency of tests, it really depends on your perception of the risk. And right now, people who are in contact with other people who have had COVID-19, then they would be encouraged to isolate themselves and, of course, administer tests immediately and then 72 hours later. And while isolation, please keep away from other people, including your own family members. So this is, I think, the guidelines that have already been set up.
Doctor, another scenario. Now, my co-presenter, Olivia Quay, has sinusitis. How often should people like her do the ART? Is it every time they get a runny nose, for example?
That's going to be very tough, right? So it is difficult to tell whether you have allergy symptoms that result in running nose, or you could be having some sort of upper respiratory infection. So my advice to my patients usually is that they should be testing themselves if they feel unwell. And then for people with allergic rhinitis, please take your medication or see a doctor to sort it out if you are unsure. I think if in doubt, I think that check it out. That is what my advice to my patients. Right,
so it's erring on the side of caution, yeah, Doctor? Now, Doctor,
right,
there are several care routes, self-isolation for 72 hours, like you mentioned earlier on, and home recovery being two of them. Doctor, help us understand what are the differences between them, given that both require a person to stay at home and have no contact with anyone else?
I think that self-isolation is a responsible thing to do. And Ministry of Health, of course, have given out free test kits for people to stay at home and check themselves in case they are worried about contracting COVID-19, that they have already got in contact with someone. And if those who do not yet have a positive test and they want to isolate themselves, please go ahead. I think that's the responsible thing to do. But those who already have got close contact, and if they have tested positive, I think the preference is to visit a family physician in a PHPC clinic and get it tested for sure. Because the test kits are about 80% accurate. And of course, there's a confirmatory test, which is the PCR test that can be done at these clinics. And that will give you peace of mind, right? And gives you that 100% or close to 100% chance of not missing an infection. So that would be the responsible thing to do. And for those who cannot or unable to leave their home, or they just want to do their self-test, then they should be doing it for 72 hours later once they have got a positive test. Now, if the tests are indeterminate, that means they are not sure whether it's yes or no, they're still very much strongly encouraged to visit a PHPC clinic to see your family physician.
Thanks for your advice, Dr. Tan, and for taking time off to speak with me. I've been speaking with Dr. Tan Teck Jack, who's CEO of Northeast Medical Group.